My name is Natalie Callander, and I'm from the University of Wisconsin. And one of the most exciting presentations here at ASH, something that merited what we call a late-breaking abstract status, is a whole new concept that's emerging of what are called in vivo CAR T processes. Now, in vitro means made in the lab. In vivo means made in the body. And so this technique is evolving where, in this case, a study was presented on actually four patients are going to be presented, who received a novel way to do this, where they got an injection actually of a virus that carries the genetic information so that you will alter the T cells in your body to become essentially CAR Ts. And the beauty of this is you don't actually get any chemotherapy along with it. The injection just occurs, so there's none of what's called lymphodepleting chemotherapy, which is right now a standard part of CAR T. And they were able to show in these individuals that this technique did in fact produce these CAR T cells and that they appeared to be active. And so that they were able to show that all of these four patients had a response which very much mirrors what you get with both experimental and commercial CAR Ts that are manufactured outside of the body and infused back in. And there are a lot of very exciting studies underway in myeloma trying to use this kind of technique. This study is called inMMyCAR, but there are others that are using not just direct virus injections, but nanoparticles to help introduce this genetic material to the person's own T cells. So this is very exciting stuff, and we're hoping to hear more about it.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.